Hello everyone. Welcome to Yashoda Hospital's yet another episode, the Health Talk session. Most of us have experienced some gastric issue at some point or the other. So let's discuss about common gastric issues with our doctors today. I'm Dr. Lakshmi and let's welcome medical gastroenterologist consultant from Yashoda Hospitals, Secunderabad. Welcome, sir.
Yeah, hello everyone. I am Dr. Rakesh Kumar. I am a consultant gastroenterologist and an interventional endoscopist. I am currently working at Yashoda Group of Hospital at Secunderabad. My areas of expertise are advanced endoscopy, endoscopic ultrasound, and the newer third space endoscopy. And I have been practicing gastroenterology for now nearly 10 years.
That's great, sir. So, sir, how did you develop an interest for this field, that is medical gastroenterology?
Well, as you know, Dr. Lakshmi, any journey to become a doctor, it's like performing a penance. And when you start, the idea of becoming a doctor it always comes up very early in the childhood. And for me also, the idea started very way back in my high school, when I started developing a keen interest that probably this is the profession that I want to pick up. And eventually started working on that direction. And of course the big influence for me was my father, who was after me all the while, and he was the one who pushed me towards this field. And eventually I picked up science as my topic, and then I made it in my first attempt to Usmania Medical College, and that's where I did my MBBS. And as you know, once you are in it, as the journey continues, I started picking the finer traits of the profession, and very soon, by the time I reached my housemanship, I decided that probably general medicine is what I wanted to practice further. And sometime in 2007, as soon as I cleared my MBBS, I enrolled myself into general medicine after clearing my entrance. And 3 years later, I did practice for 1 year as a physician, but I was not very satisfied with the way it was. I wanted to do something more. And my final year thesis in MD General Medicine was GI related, and I had a little inclination for gastroenterology. So I picked up that thread. I appeared for a DM entrance, and I was able to secure the first rank in the erstwhile AP, and that's how I made it into Usmania for DM gastroenterology. So by 2012, I finished my DM gastroenterology. Again, the profession made me more, it wanted me to achieve something more. I didn't want to settle down, so I decided that I'm going to pursue further. And then I picked up a fellowship at Dr. Amit Medhio, who is one of the leading endoscopists from India. He practiced at BITS in Mumbai. That's where, it's kind of the place where I worked for nearly 1 year with him. And that's where I picked up the finer traits of the gastroenterology. And after then, once I thought I'm done, I came back and I've started practicing.
I think that's a great and a lovely journey what you've been through. So, sir, on a lighter note, if not a doctor, what you would have been?
Yeah, if not a doctor, well, I think I would have ended up becoming a teacher. Because, teaching is something that has been, is something I'm very fond of. Even right now, I do that a lot. So, plan B was always to become a teacher.
So, talking about endoscopy, sir, so would you like to explain what is endoscopy to the general public out there and who should undergo and when?
Well, now endoscopy is one modality of trying to address the patient's symptoms concerning with his upper abdomen. Any patient who has a lot of upper abdominal discomfort, either in the form of what you call as heartburn, reflux, or a lot of vomitings, or there is a sudden loss of weight and appetite. I think endoscopy is a very basic modality of trying to investigate and find out what exactly is happening in the upper abdomen. And times have changed. The procedure has become very minimally invasive. Probably any patient who is requested to undergo this procedure just need to report to the hospital or the place where he was asked to come up with 8 hours of fasting. And at Yashoda, we are taking every care and precaution, and this procedure is usually done in 5 to 7 minutes, and usually we are doing it under sedation to take care about all the patient apprehensions and the pain which they would experience without a sedation. And 1 hour post procedure, probably patient is good to go back.
So this is done under sedation and it's not painful.
Yeah, I think the concept of endoscopy has changed. There's a big sea change. I mean, 10 to 15 years back, when I was working as a resident in gastroenterology, probably most of our procedures were without sedation. So it would end up causing a lot of trauma to the patient. Now this has been taken care. More and more centers now they are offering endoscopy under minimal sedation. What it means is that probably if you do an morning endoscopy under sedation, by afternoon 12, patient is good to go back to his usual self and the work that he does. So that's the big thing that's come up. So I think that really makes the procedure very easy for the patient.
So sir, now there is a lot of information on the internet and most of the patients Google the symptoms and come to your OPD with a predetermined diagnosis and asking for an endoscopic procedure. So how do you manage? I mean, do you advise or you go with them?
The arrival of Dr. Google has definitely changed how we are tackling our patients. Definitely now more and more we see patients who come with their own predetermined diagnosis. In fact, I can say that. So it's sometimes it's a challenge to go through them. But call me old school, but I still follow the same conventional what you call the way. That is, I would definitely assess the patient's symptoms and signs, and then if I find some red flag signs, what I mean when I say red flag sign is that anybody who's elderly, more than 4 weeks of symptoms, unexpected weight loss or loss of appetite, I think these are the subset of patients in whom I would probably definitely concur with them and ask them to get an endoscopy. But if I see a young guy, somebody who is like 30, 35, coming with first time 2 weeks history of abdominal discomfort, I may differ from him. I may in fact ask him to go for probably a little bit of 1 to 2 weeks of medication. If there is no response, probably then I might post him for an endoscopy.
So sir, what do you remember about going to a doctor or visiting a hospital for the first time when you were a kid? What were your childhood memories like?
Well, I think kids and doctor, they don't gel well along. Apprehension, fear is always something that will be written on our faces. But the interesting thing I can tell you about my interaction is that in my childhood I had this very strange habit of putting up chalk pieces in the mouth. I would do that very often. I was very fond of the chalk piece thing. So I still remember that. My father one day took me to the pediatrician. So I was waiting in the lobby. We would see a big flow chart diagram of a GI tract on the wall. So my father took me to the GI system there, and he showed me that the more you eat this, it will one day get blocked up in your colon and you would end up with an abdominal pain. Probably that was my first interaction or the first image of a GI tract. Maybe that got imprinted on my memory, and 15-20 years later I am a gastroenterologist.
That's great and wonderful. So similarly, we'll be seeing so many kids with foreign body ingestion, especially the toy batteries or the chalk, and more commonly the coin. So how do you think one can prevent this?
Well, it's a tough challenge, Now, it's tough, you can't monitor your kid all the time. But definitely one general precaution I can tell all the parents out there is that, try to see that your kid doesn't handle these batteries, maybe, keep them away from them. But now, especially in the COVID lockdown, we ended up seeing too many kids coming up. Maybe most of kids being restricted at home. I ended up seeing a lot of kids coming with battery injections, and, even in fact, I saw kids ingesting magnets. So I think it's a tough ask, but general precaution I can tell to parents is see that these things are not within the vicinity of your child.
So now talking about a lot of younger generation undergoing endoscopy and presenting to the OPD with a lot of GI issues. So what do you think the cause is? I mean, do you think the sedentary lifestyle or the eating habits have got something to do with this?
Yeah, absolutely. I think, in the last 20 years, I think there's a big sea change in the lifestyle. I mean, sedentary lifestyle, westernized food, refined diets, high cholesterol diets, diet with, calorie dense diets, and with minimal workout. I think these are the things that have really done a big shift in the, the effects that we are seeing on the GI has become enormous. 20 years back, probably in a standard Indian diet was more of fiber and more of carbohydrate. But in the last 20 years, we have started aping the Westerners so much so, and this Western diet is actually leading to more and more of these upper abdominal dyspeptic symptoms coming up in the younger generation a lot.
So, sir, one of your special interests is third space endoscopy. Tell us more about this.
Yeah, I think third space is endoscopy is something that has been very close to me. I mean, if you ask me what exactly is third space endoscopy, see, there has been a big boom in the endoscopic interventions since 2010. And one of the big thing that has come up is that the advances in the endoscopy instruments and the accessories have started allowing the gastroenterologists to reach the areas which were something probably not imagined 20 years ago. So what I mean by third space endoscopy is that conventional endoscopy, you are trying to look at the lumen, that is the GI system inside, either the end of esophagus, stomach, or the colon. So whenever we come across any lesions, it can be a subepithelial growth, or it's a small adenoma or a polyp. Probably previously our role as a gastroenterologist was limited to diagnosing them and probably referring them to the surgeon for further intervention. But with the arrival of newer accessories and advanced scopes, we have created a new subset called as third space endoscopy. So what we mean is that using the same endoscopy and the advanced accessories, we are able to recognize these small polyps, adenomas, or the lesions in the stomach, esophagus, and colon, and using the endoscopy, we are able to give a patient a curative therapy, which was probably 10 to 20 years was a surgical thing. So I think third space endoscopy is allowing us to even detect early esophageal cancers, early gastric cancers, or in fact even early colon cancer. If we pick them early, we are able to endoscopically resect them. And that's the big thing that's with the third space endoscopy.
So the diagnosis and the treatment, it happens simultaneously.
Absolutely.
At the same time.
And one of the big thing of the third space endoscopy that has picked up in a big way is what is known as perioral endoscopic myotomy, that is POEM. So previously we had this entity called as eclasia cardia, which is nothing but too much of tightening in the food pipe. So when there is too much of muscle tightening, it doesn't allow the patient to have a proper food meal which he cannot swallow in. So most of the time they end up kind of vomiting or having severe pain. So 10 years ago, all these patients would end up on a surgical table because Heller's myotomy was the only treatment of choice. But in the last 5 to 8 years, we are using this third space concept. We have come up with a procedure known as perioral endoscopic myotomy, where all these patients of eclasia cardia, we would do the same procedure which a surgeon would do on a surgical table, and we would do this not in the OT but in our regular endoscopic room. It's a 1 hour procedure, and once the procedure is done, we discharge the patient within the 24 hours. So the minimal invasive nature of the procedure is what attracts it, and that's what makes it so easy on the patient and on the doctor side.
So that means faster recovery, lesser stay in the hospital, and the diagnosis and treatment, it happens simultaneously.
Absolutely.
So that's like the newer techniques which are on the rise right now.
Absolutely. And I would like to probably add now that probably in the two states combined together at Yashoda, we have got the second best numbers. I mean, the number of poems we have done is probably second. We are standing right now second, and most of patients are quite satisfied. And the big good thing is that patient is back home within 24 hours. That's the good thing about the procedure.
So, sir, talking about colonoscopy, as you've just mentioned that while doing this procedure, you see epithelial growth which could be precancerous. So, ideally, who should undergo colonoscopy and when?
Well, again, unfortunately, unlike the Western societies, the Western gastroenterology societies, they have got a very good guidelines giving it a very clear indication to the patient when are the situations where you should approach to a doctor for a colonoscopy. We at India, we do not have a good guidelines regarding this aspect. But in general, what I would suggest to all is that anybody who is above 50 years, or anybody with a family history of colon malignancies, or anybody who is having anemia, or chronic abdominal pain or a new onset of constipation. I think these are the particularly 5 to 6 indications or indicators where the patient should immediately approach the nearest gastroenterologist and probably get himself colonoscopy done, just to make sure that everything is okay on the inside side.
So, sir, as you just mentioned that during this pandemic you had hectic working schedule. So, how did you balance your work and personal life?
I think in general, that's probably a doctor's. It's a screwed up thing for doctor. He cannot balance his work and his professional and personal life. It's always an imbalance thing. That's what I feel. But what has happened is that I think there's more with the arrival of the COVID. The stress and the strain on doctor has significantly gone up. So I think now there's a general consensus among all my colleagues now is that more and more we should try to actually start balancing these two ends. And on my side, what I generally do is that most of the time I do a lot of physical outing. That really makes me feel better. So cycling is what I do on a regular basis whenever I have a chance. That gives me a really peace of mind. Probably introspection is something I can do when I'm alone. And if not that, of course, like anybody, I read a lot of books. So these are two things that make me go along and makes me keep a balance between the professional and personal life.
Read a lot of books. That's interesting.
Well, that's the bug everybody a doctor gets in, because 18 subjects in 5 years of MBBS, you will end up start liking all your books.
So thank you, doctor.
Yeah, thank you. It was nice interacting with you.
So this brings us to the end of this episode. Thank you all for catching up with us, and do join us for the next week as well. Thank you and stay safe.